The only difficult part is you and your mindset should be willing to accept them. As promised in the thumbnail, with just 20 rupees, I am going to make your OPD process more unique and more luxurious. I am going to teach you the main secret of a successful dentist. Hello doctors, welcome. This is going to be a moneymaker video for you all. I strongly believe, and I have personally experienced, that uniqueness always stands out. It is one of the major pillars for entertainment sector and for marketing sector. They aim for uniqueness, that is something different from others, to attract attention. I am going to point out few things that you can do to stand out unique from your competitors. All the suggestions will be very cheap and very easy to implement. The only difficult part is you and your mindset should be willing to accept them. I guarantee once you implement them, it will have a great impact on your clinic's reputation. Once again, hello doctors, welcome. I am Dr. TARUN MAVADIA from Akshar Dental Academy. Let's begin. We will discuss this topic in following 3 sections. First, when patient enters the dental clinic. Second, when patient enters the dental chair area. And third, when patient is on the consulting table. The first section is when patient enters the dental clinic. My suggestions in this section are: number 1, dress code. All professional establishments have dress code, starting from school to airlines. We doctors and nurses or dental assistant also have their own dress code. That is apron and head cap for your dental assistant, and additionally a mask for the chairside assistant, and surgical gown for the dentist, and additionally face shield and N95 mask when the dentist is working on the dental chair. Doctors, please remember, scrubs and surgical gown are 2 different things and they have different applications. Scrubs are the attire which you wear to your dental clinic from your home, or you change into scrubs in your dental clinic. But surgical gowns are sterilized gowns and you wear them on your scrubs. You can skip on scrubs, but you cannot skip on surgical gowns for your surgical procedures. My second suggestion in this section is manners of your assistant or your receptionist. Your dental assistant or receptionist should be well dressed, that is as discussed in your clinic's dress code. The dress should be neat and clean. I would suggest you to use grey or cream color, as they don't get more dirty with more use. Your dental assistant should be very attentive to the patient. They should be polite and soft-spoken. Keep no mobile policy for your assistant when they are in your dental clinic. Doctors, please remember, first impression is the last impression. For any clinic or hospital, the first impression is set by the way and manner they are greeted once they enter that particular clinic or that particular hospital. So think on it and act accordingly. Also doctors, I know in initial days of our practice, it is very difficult to manage, but I would suggest you to have at least 2 dental assistants in your dental clinic. Remember, to make more money, you have to spend some money. My third suggestion in this section is patient wrap and head cap. We do this at my every clinic. It makes us unique and gives out clean and hygienic vibe to the patient. Female patients particularly love them, as females are more conscious about their precious dresses and hair. Many times there are spillage of water from our air rotor or scaler, or sometimes when patient is about to gargle. Patient wrap or bibs does the best job of protecting clothes and hair from water spillage. We use them for our every patient. No patient enters the dental chair area without them, no matter how long the treatment is. The kit is assembled by my dental assistant in my dental clinic. It has a silver bag which is used to pack food items. My assistant places 1 head cap and 1 gown in the bag, and the bag is sealed with the sealer used to seal our surgical pouches. Now considering the cost factor, the cost of the silver bag is less than 50 paisa, 1 rupee and 50 paisa for the head cap, and approximately 4 rupees for the saloon gown. So in total, the whole kit costs around 7 rupees. This kit costs only 7 rupees but gives an impression worth hundreds. Teach your assistant to inform all your patient very smartly that this gesture is for the safety of the patient and to protect patient's cloth and hairs. Now coming to second section, that is when patient enters the dental chair area. As promised in the thumbnail, with just 20 rupees, I am going to make your OPD process more unique and more luxurious. When patient enters the dental chair area, patient will look and observe the whole area, that is starting from dentist to dental chair to the interior of the room. The dentist, as discussed earlier, should be in the dress code, that is surgical gown. And my first suggestion in this section is your dental chair should be neat and clean. Use this type of clean transparent films or wraps to cover it. They are available in such rolls. This film will keep your chair neat and clean and shiny for many years. Once you apply this film lasts for weeks and its cost is not even 1 rupee. My second suggestion in this section is use packed water bottles for gargling and insist on the use of tissue paper. A bottle will cost 5 rupees or less, but this 5 rupees bottle will give impression worth thousands. Also, you must have tissue papers on your dental chair. I have seen many good clinics skipping on the use of tissue paper. A 25 rupees pack of a tissue paper has more than 100 tissue paper. Your patient might use maximum 4 tissue paper and that cost not even 1 rupee. I suggest give them freely to all your patients. We additionally encourage the use of tissue paper and ask them to avoid spoiling their own personal handkerchief. Doctors, treat your patient as royalties and give them a luxury experience. We all like to be treated as luxuries, and such gestures in fact motivates the patient to go for good treatments. My third suggestion in this section is use seal pack sterilized instruments. All instruments in your clinic should be seal packed in sterilization pouches. It is must and also your duty to follow strict sterilization protocols. One sterilization pack of 15 cm length when cut from a 200 meter roll will cost less than 3 rupees per pouch. My fourth suggestion in this section is regarding the use of instrument tray. Your instrument tray should be clean and it should look hygienic. After many trials and errors, I have found the most easy and cheap way to get this done. You can use a disposable tray cover like this one on your working tray. I use this type of plastic tray and on that we use this disposable green guava tray cover. One tray cover costs less than 3 rupees. By using such disposable tray cover, it makes your work process more clean and more hygienic. So till now for our OPD we have spent 7 rupees for the patient wrap and cap kit, 5 rupees for the water bottle, 1 rupee for the tissue paper, 1 rupee for the clean film wrap on the dental chair, 3 rupees for the disposable tray cover, and lastly 3 rupees for one sterilization pouch. That brings our total to 20 rupees. These 20 rupees are totally worth it. And you will also agree, it makes your OPD process more hygienic and more unique. I have a message for new dental practitioners. Don't do free OPDs. People don't respect the value of free. Instead, charge what your competitors are charging and give additional services at the same charge. Use such unique items for the comfort and safety of your patient. Every Indian mindset will definitely compare, and so will your patient also. But on conclusion, your work process when compared to others will be more hygienic and more unique. And I guarantee it will definitely stand out. Still, I am not done yet. The main money maker point is yet to be discussed. That brings us to our third section, that is when patient is on the consulting table. Now listen very carefully. After making your OPD process more hygienic and unique with just 20 rupees, I am going to teach you the main secret of a successful dentist. All the magic happens here. Your conversation with the patient on this consulting table can give you or lose you a patient for life. This part on the consulting table of the OPD is the main money maker for you. Now, once the OPD is done on the dental chair, we shift our patient to the consulting table. Doctors, remember, for a good OPD, you need intraoral camera and 2 screens in your dental clinic. We have already discussed why and how for them in our first video part of this series. Now I won't say go and watch it. All the dentists who want to become a better dentist will definitely do the necessary thing to achieve it. But all those who are stiff and lazy and are not willing to make a small effort and go and see the things which are free, no one can help them. Their laziness and stiff mindset can never make them great. Okay, now let's come back to our point. Along with intraoral camera and 2 screens in your dental clinic, my main suggestion in this section are: 1. You need patient education pictures for all the dental treatments. Make a patient education folder on your computer's desktop like this one. I have a same folder on my every computer at my every clinic. Such pictures make our conversation with the patient more easy. Patient is able to understand different parts of the treatment very easily, and it makes the doctor's job more easy. Now, to guide you more further, my top 5 suggestions for pictures of patient educations are as follows. Number 1, RCT pictures, showing comparison between a good RCD and a poor quality RCD. Number 2, filling, pictures showing a good quality composite filling versus a GIC bulk filling. I call them finger press fillings versus a partial filling. 3rd is scaling, gums under periodontitis versus healthy gums after scaling. You can also place pictures of stain before scaling and after scaling. Number 4, re-RCT, pictures of the tooth before treatment, after cleaning the GP cones, and finally perfect re-RCT pictures. Number 5, smile design pictures, etc. My second suggestion in this section is study or work model for all the major dental treatments. This works best in convincing patient for a better dental treatment. When you show your own work model to the patient, it sends a good positive vibe to the patient that this doctor does all this treatment very regularly, as he is prepared thoroughly with all the aspects of the treatment. According to me, you should have the following work model. First is our most common and easily available acrylic model, which has many dental treatments in them like implants, bridges, etc. This model is easily available from your local dealer or online also. Along with this ready-made model, you will need few custom work models also, and my top suggestion for such custom made models are: number 1, work model with different types of crowns, that is metal, PFM, zirconia, monolith, multi-layered, etc. Second, few denture samples showing different quality of materials and finishes. Number 3, cast showing over denture. Number 4, smile design cast pre-op and post-op. Number 5, cast with thin and thick alveolar ridge, helpful in cases of implant and dentures. So doctors, that's all from me on this topic. All the suggestions here are tried and tested for many years by me personally and by many of my students also. So with just open mindset, try to implement them and I guarantee positive results. See you all in yet another dental video. Until then, stay tuned to this channel. Thank you.